Thank you for this opportunity. I'm going to talk on an application in ophthalmology, an app which we innovated called the IMG3D. So this is a three-dimensional app targeted for neophytes, residents for teaching purposes as well as for counseling. So most of the applications today, there are so many apps in ophthalmology. There are 2D and 3D animated images is what there is available currently in the market. So our aim was to build a novel app which uses real images, and we have done it using real-time confocal patient's own images with wide field 110-degree true color confocal images, and the gonioscopy structures, as you can see, the slit lamp structures, they were all real structures were used. We used the Unreal Engine software to actually keep a sequel of 12 cameras to 16 cameras inside, and we gave the power of choice to the user so that they can choose whichever frame that they want to choose. So this is the application name IMG3D. Once you open the app, you have three buttons called the anatomy, pathology and the videos, and the videos are also available in real-time 3 dimensions. So we wanted to solve the problem statement of creating an app which is as real as possible to the patient's real-time images for learning. So you can see here, once you click the anatomy button, you have a dynamic feature where it's not a static app, it's a really dynamic app which gives you the eyeball of the patient. And now they can choose anterior segment. By clicking on the anterior segment, you can click on angle and see the gonioscopic structures in real time. And also the electron microscopic view, if wanted, can also be chosen by clicking on the trabecular meshwork. So we wanted the choice of learning to be there for the neophytes and the residents. Similar thing goes in for the posterior segment as well. So this is the vitreous on and off can be done. Similarly, silicone oil on and off buttons are also catered. So the fovea can be studied as well as the optic disc. So these are all the normal structures that we provided in the application. So from the normal structures, we started updating a multimodal imaging atlas as well in the pathologies. So all the pathologies such as complex pathologies, you can just go to the pathology section. There is a flecked retina here, for example. The color fundus is there. You can choose autofluorescence. You can choose an infrared. Along with the annotations, a comprehensive multimodal imaging atlas is provided. And also you can see that a splinter hemorrhage, for example, if it is chosen, it can be seen in infrared, and the same infrared can also be focused by zooming in and viewing. And also you can go back. Now you can choose, for example, fibrovascular band. Again, you can see the disc, or you can go to the periphery and you can see. So there are a lot of dimensions that are there in this app. If a retinitis pigmentosa is there, we have given an autofluorescence. It's more like a multimodal imaging atlas or a book that we have given with normal patients, flecked retina to summarize, a fibrovascular band. Not only the fundus, we get a total of all the filters that you want, a glaucoma nerve fiber layer defect, myelinated nerve fibers, splinter hemorrhages. So this is the innovation that we did with neovascularization elsewhere, and more pathologies are keeping on adding once every 2 weeks in this teaching app. Even if you see the videos, if for example a central retinal vein occlusion video is chosen, the whole dimension of this is shown as an unanimation. It's not an animation, it's an unanimation. This is how it happens in the real time. You can see real time fundus and how the block actually causes a central retinal vein occlusion can be shown in less than 30 seconds. It's like a snippet for them to really learn the pathology. So this is a video showing the tomato splash appearance and then summarizing the RAPD that can be seen in this patient. And you can see that it goes in and it just shows. These are all dynamic features which the users can actually choose. So the RAPD can be shown, and if not treated for 90 to 100 days, it will go into a neovascular glaucoma. So concepts which are very complex can also be summarized in a very short 30 to 40 second videos are also available. So it's not only anatomy, there is pathology as well as this. So what we then wanted to validate this app. So we also gave it in Windows. If people are not comfortable in phones, the bigger display Windows is also available, and this is what it is. We assess the satisfaction level of the classes taken for first year postgraduates with the IMG3D app and without this. It was a cross-sectional study conducted with the users who downloaded this, a comparative study regarding the questions pertaining to the knowledge, comprehension, graphics in the app, gamification, tutorials, innovative representation, and the additive 3D features. So the invitations were sent through Google Forms. 217 invitations were sent. We had 203 respondents. We had more than 500 downloads for this app actually, and the study period was actually 1 week. So in that we got, these were the feedback. The satisfaction levels were classified as satisfied, neutral and dissatisfied. The discrete variables were converted into a continuous variable, and paired t-test was employed. and the p-value that we got was quite significant. The pie diagrams will be following. So what we wanted to see is how does the app really cater to the residents or the neophytes we wanted to evaluate. The student satisfaction when they read some complex things to the IMG app was much better. It was more than 90%, 96, and the satisfaction level was 89%. It's not that different, but the experience was slightly immersive. So that made the difference for a pedagogical transformation with this teaching app. And also for counseling, a simple YAG PA, anti-VEGF, or a trabeculectomy or a retina surgery, when you use real-time images, it really makes a difference, where we slightly move from animations to unanimations. So according to our knowledge, there is no application to date in ophthalmology which uses real-time confocal multimodal images and photoreal visuals for interactive 3D learning. We wanted to bring unanimations into ophthalmological app making to make these concepts for pedagogy and counseling. This is available, and if you can scan the QR code and get this app in your Android phone. Thank you for this.